Russ Fairbanks, Fairbanks Orthopedic Clinic. I'd like to speak to you a few moments about painful knees. We see a pretty good patient population with knee pain. Most of them are not people that need total knees, and very few of them are kids who have ruptured a ligament that needs more advanced care than we provide here in my clinic. We send them on out. But the average patient that has knee pain, it can be just some minor or a little bit more advanced tearing of cartilage due to a twisting injury or the wear and tear and aging. Most of the patients will present saying, my knee's been hurting me. There are certain physical examination findings, but what you'll find is they have pain when they walk and pain if they go up or down stairs. They have pain if they squat. That's because the two bones are crushing the torn cartilage in between the two bones. The thing about the cartilage of the knee is once it starts tearing, it doesn't heal up. So what we do is we take a look at the patients in the clinic. We get x-rays. If necessary, we get an MRI. We'll often put a little cortisone with some pain medicine into their knee by injection, and maybe put them on a home exercise program and follow them up. A good many patients come back feeling better and a little medication, and we observe them for a bit and let them go. There are a few patients that are much more advanced than what we can take care of in an outpatient setting, and we refer them to knee replacement surgeons, as I quit working in hospitals and doing knee replacement years ago, but I have a special interest in arthroscopic surgery of the knee. After many years ago, I did a sports medicine fellowship at the American Sports Medicine Institute. At the point that we need to commit to doing something arthroscopic, that usually takes about 15 minutes, 2 little small incisions in the knee to visualize the torn cartilage through the scope, and we trim up the cartilage through the scope. Now I'm going to show you on a drawing what the commonly torn tissues in the knee are and help you get a little bit better understanding of that. Now this is a drawing from the front of a knee. This is the thigh bone or femur. This is the shin bone or the tibia. There are basically 2 different areas of cartilage that can be torn. In the kids, the young people, it's usually the pads between the 2 bones, which are made out of cartilage, called the menisci. If you cut this bone, the tibia, your shin bone, across the top and look at it from the top, those meniscus will be around the top of the bone on either side. Most commonly, the inner or medial side of the joint is what's involved about 90% of the time in all torn cartilage. And with those people, the young people with a torn meniscus, if we can't get them better, a 15-minute scope with 2 little small incisions into the knee, and we trim up that torn cartilage. And it's not uncommon for a high school football player or basketball player with a little torn meniscus. If you know how to rehab them properly, you can get them back on the court or on the football field in about a week or 2, pretty easily, high percentages of the time. In adults, in middle-aged people, the problem is a different area of cartilage, which is on the end of the thigh bone or the femur. The thigh bone has gristle on it, just like the gristle on the end of a chicken bone. That gristle is called articular cartilage, and it's the smoothest substance that man knows of. The thing about that cartilage, though, is once it starts tearing, it doesn't have any healing capabilities, and so it just gets worse and worse. And that is demonstrated by this area on the end of the thigh bone. And we oftentimes, if the injection doesn't help out and the patient's not bone on bone, showing that they need a total knee, and the MRI shows what we need to see, we can peek in the knee with the arthroscope in about 15 minutes, trim up that torn cartilage on the end of the bone, and good percentages of patients respond quite nicely to that treatment. It's just everyday orthopedics. Torn cartilage of the knee involving either the meniscus or the articular cartilage on the end of the bone. I hope that this video is informative to you. If we can help out with anything concerning a painful knee, our doors are open. All you have to do is pick up the phone and call. And don't forget that for those of you who have to pay part of the healthcare cost, the tremendous cost savings available by going through an ambulatory surgery center instead of a hospital. We also have X-ray, MRI, and just excellent physical therapy services right here in this location. So if there are problems with your knee that we can help you with, please let us know. We do a pretty good bit of outpatient arthroscopic surgery of the knee just to trim up a little torn cartilage. We keep it real simple, or we refer it on out. Thank you very much. Hope you have a great day. Look forward to seeing you in the clinic.